4 stages. First, we have oral preparatory, the oral phase, the pharyngeal phase, and then the esophageal phase. An additional phase that is not new, but um it has been considered already, but it is named now as your anticipatory phase. Okay? So here is a short a picture of the anatomy. So we already know your hard palate, your lips, okay, your mandible, so the bones, and then the muscles. Okay, review that, and then here, so we also know this. Diba? Can you still remember this? In your kines or anatomy, facial structures or oral muscles innervated by your facial nerve, cranial number 7. Your jaw, it's more on the cranial nerve number 5. Your for the tongue, uh, 7, 9, and 12. And then next, another nerve that we have to consider is your 11 and 10. Okay, your accessory nerve and your vagus nerve. Okay, you can just read through this as your reference for review of the muscles and then their actions and then the responsible cranial nerve. Then here, so the esophagus is innervated by your vagus nerve. Okay, next. Okay, I'll share a video first. Let's um, watch this for a while. For a while. Okay, so let's in this video we could see the 4 stages of swallowing. Okay, and how does the food or the bolus travels from the mouth towards the stomach before we discuss each phase of swallowing. Okay.
Swallowing consists of the safe
For a while. Oh, sorry. Can I ask somebody to share the link? I think medyo hinay. Oh, can somebody share it, please? Okay, so I will try again. Don't worry. Okay, thank you, Maxine. Okay, you have the audio, Max.
I
There.
dili madungog, miss.
Very well. Let's try again.
I'll try, miss.
Swallowing consists of the safe transport of saliva, solids, liquids from the mouth to the stomach. This complex mechanism requires the coordination of the mouth, pharynx, larynx, and esophagus. Each second requires the work of 31 muscles. Swallowing consists of 3 different stages. During the oral stage, the food is taken into the mouth and stimulates the different taste organs. The food is chewed on and wrapped in saliva to form what we call an alimentary bolus. Once the portion is ready to be swallowed, the tongue propels the bolus towards the pharynx. During the pharyngeal stage, the bolus arrives in the throat, which triggers the swallowing reflex. The epiglottis folds down to close the larynx to protect the respiratory tracts and to allow the bolus to travel from the throat to the esophagus. The esophageal stage is characterized by the passage of the bolus from the esophagus to the stomach thanks to the relaxation of the upper esophageal sphincter.
Thank you, Raquel. Okay, so you can see again, by the way, the bolus is, let's define bolus. The bolus is the chewed food or the masticated food that kanang encircle and 'di ba once medyo mix na siya ba then kanang ganing circle na siya. That's what you call the bolus. Okay, the food that we um take. So, although in the video, anticipatory and oral prep is not discussed, we could see how it moves from the outer oral structures or upper oral structures towards the pharynx, and then the closure of the larynx, and then towards the esophagus. Okay. So the anticipatory state phase begins even before the client enters the dining area. So what would you expect in the anticipatory phase? It is okay. So it is more of a siguro na pa siya sa mind ba nga. Oh, like kita 'di ba when we girl for like lunch, padungta mo lunch, like around 11 or 10 in the morning, na natay mga thoughts unsa atong kaunon. So that is your anticipatory phase. So basically, that's it. Okay, so you could imagine, oh, maglami man mo kaon og adobo, lami mo kaon og pasta. Okay? So, it is the client's expectations of the eating experience. Okay? Sometimes, oh, lami mo kinamot, diba? And then, this is very, very important. Why? Because it is a precursor to successful eating. Okay? So, if a person said, wala siya expectation, wala siya motivation, then we could expect nga, if the person participates in the eating as an occupation, there might be possibility na they will not enjoy it, okay, or they will not be able to finish their food, and then once that happens, we go back to their health and wellness would be impeded. Okay. So that is your anticipatory phase. And during this stage, there are still a lot of factors to be considered. So such as the variety of foods, the presentation, the seating during meals, the atmosphere, the caregivers, um, if their presence needs to be there, no, and then their habits or routines. Because, for example, talk about caregivers, because some clients may need assistance or supervision during if they have dysphagia. Okay, because the possibility of choking, aspirating is high, especially given the disorder. Okay. Questions with anticipatory phase? Before we proceed to the next stage. Okay, none so far. Next, we have the oral preparatory phase. So in this stage, food is already masticated by the teeth and gums. Okay, meaning it's already chewed. It is manipulated by the lips, cheek, and tongue to form a bolus of appropriate texture for swallowing. In this phase as well, food is not chewed properly without the saliva, because the saliva is the one that mixes with the food to prepare the bolus for the swallow. So, what are the three pairs of salivary glands? Three pairs of salivary glands. Does anyone remember? Parotid. We have, that's letter P. What are the two S? Sublingual and your submandibular. Very good. Good job. Okay. In your oral preparatory phase, it starts or begins as the tactile contact is made with the food. Okay. So right after the feeding, okay, oral preparatory phase happens. So food touch the lips, okay? Our reflex is our jaw comes forward to open, and then after mo open, isulod ang food sa mouth, the lips close around the glass or utensil, glass if liquids, or utensil to remove the food or liquid. Okay? Our lips or labial musculature forms a seal to prevent any material from leaking out of the oral cavity. Okay. What do you think will happen if the lips cannot seal properly? The problem would be mugawas ang food. What else? Air will go inside. Yes, that's correct. What else? Remember that your food is mixed with saliva, so we could expect what? This is very common. Your drooling. Okay? Very good. So, bantay mo like, usually dysphagia manggod it, for example, you remember the paralytic dysphagia and the pseudobulbar. So, it is a comorbidity of other disorders such as stroke. Okay? So, if there is weakness, nabantay mo na even adult clients nga magbib na sila. So, mo na sila para sa ilang drooling problems. Okay? So, na ang food sa sulod, nag-chew na. That is your oral preparatory. And then, the other structures that has responsibility is your mandible and your tongue, because they move the bolus towards the toward they move the bolus backwards towards the other structures. And remember, if mag-choose ta dili rasad, isa ka side ang atong gamiton, di ba? We have tongue movements such as rotary and lateral directions, di ba? From one side, balhin na sad sa other side, and then vice versa. This is to properly crush the food or chew the food inside. Okay? The tongue moves laterally to push the food between the teeth. For example, diba, when we try to swallow, wala naman dyan ay mabilin sa mouth. Okay, so that's the action of the tongue. And then your buccinator muscles, okay, of the cheeks, so that's on the side. They also act as lateral retainers to prevent the food particles from falling into the sulcus between the jaw and the cheek. If ever naasay food, for example, are you familiar with food pocketing? Kanang mag-ugom? Familiar? Familiar with food pocketing? So there's food
Yes,
in the
miss.
cheeks. So okay, so food in the cheeks. So if the if the tongue is weak, okay, it's okay. If the tongue is weak, there could be food particles left. Okay, because it's usually the tongue who cleans out the or murag ilang limpyuhon ang upper oral structures before the actual swallowing to make sure nga wala na ang tanan dito nga nasulod is ni-form na siya into a bolus. Okay? So, see, the tongue sweeps through the mouth, gathering food particles and mixing them with saliva. Clear? Questions? Okay, let's proceed. So that is what I discussed. Pocketing of food in the cheek may occur if there's diminished motor control of the tongue to manipulate the bolus. Okay, and Pocketing may also indicate a diminished sensory appreciation of food remaining in the sulcus. Okay? Sensory sensory problems because, okay, for example, kabantay mo sa katong drooling, okay, or food pocketing, dili mo sila ka-distinguish nga, ay nitulo na di ay na ang akulaway because they have poor sensory functions like poor tactile. Paron, dili na sila ka-sense nga like for example, what do you call that? Temperature, no? So, di na sila murag na may something liquid there sa akong kilid sa akong cheeks. Okay? So, we have to give them sensory cues for intervention. The chewing action of the mandible and the tongue is repeated rhythmically, repositioning a food until a cohesive bolus is formed. Okay? The length of time needed to form a bolus one can safely swallow varies with the viscosity of the food. Okay, so a short time is needed for soft foods and a longer time is needed for more texture or dense foods. Clear? For example, a meat. Siyempre, mas dugay siya i-chew compared to a lugaw lang or a soup. Okay? Next, we have, aside from food, so, atong clients mo intake man sila liquid. So, large amount of thick liquids or thick and dense food require the tongue to divide the food into smaller parts to be swallowed one at a time. The posterior portion of the tongue forms a tight seal with the velum, preventing slippage of the bolus or liquid into the pharynx. Okay? So overall, it really requires a greater oral motor control and often present a difficulty for clients with oral preparatory phase swallowing problems. Okay. And then you have to remember that during the oral preparatory phase, the larynx and the pharynx are at rest. Okay. And then aside from that, aside from the larynx and pharynx at rest, our airway is open. Okay, wala pa man na-close ang larynx. At rest pa man siya because wala pa man ni-enter ang bolus. Questions so far for oral, anticipatory and oral preparatory? Okay, let's proceed with the next phase. The third, we have the oral phase. So oral phase begins when the tongue initiates posterior movement of the bolus towards the pharynx. So what happens to the tongue? It elevates to squeeze the bolus up against the hard palate and forms a central groove to funnel the bolus posteriorly. Here. And the same also with the oral preparatory, that the viscosity of the food increases. If the viscosity of the food increases, the amount of pressure created by the tongue against the palate increases. Thicker foods require more pressure to propel them efficiently through the oral cavity. And then oral phase is voluntary. Okay, so the same with the oral prep, it's still voluntary. Okay. Since it's voluntary, it requires the person to be alert and involved in the process. So when we do the intervention, we have to tell them, okay, you can now try to swallow. Okay, and even in the normal process of swallowing, di ba kita man ang mubuot kung kano sa ta mo swallow, dili man siya mukalit kaya og naog ang food. Okay, so voluntary, so it requires good muscle control. Okay, next, this stage requires, again, aside from good muscle control, it requires intact labial musculature to maintain the food or liquid inside the oral cavity, intact lingual movement or the tongue, and then intact buccal musculature to prevent material from falling into the lateral sulci, and the ability to comfortably breathe through the nose. Sorry. Okay. The oral phase usually takes approximately only 1 second to complete with thin liquids and a slightly longer with thick liquids and texture foods. So maybe if liquid like water, 1 second. But for example, for food, siguro about 3 seconds. Okay? Dili nang takabot og 10 seconds lang to, sa normal lang, just to transport the bolus up to the pharynx. Okay? If slow kaayo, like slow jud kay maabot ang food to the pharynx, then there might be problem. You can see the problem na that's called dysphagia already. Clear about the oral stage? Before we move to the pharyngeal phase. None so far? Okay, now let's discuss the pharyngeal phase. So pharyngeal phase, the component for this phase, it is involuntary. Okay, the pharyngeal phase is involuntary, but the normal swallow is voluntary involuntary. The voluntary is from oral prep and the oral. Once it's pharyngeal down, it's involuntary. So it begins when the bolus passes any point between the anterior facial arcs and where the tongue base crosses the lower rim of the mandible into the pharynx, marking the start of the involuntary component of the swallowing process. Okay? So, remember in the video, kita na to pag push sa tongue, going to the pharynx, that is the start or beginning of the pharyngeal phase. And then what happens to the larynx? Since mo pass man ang bolus, mo close ang larynx at this phase. Okay? After the swallow response, it continues with no pause in bolus movement. Remember, involuntary siya. Dili ta kayo nga, mo stop sa ako. I-stop na ko ang food going to the esophagus. No. Okay, diretso na siya. And in this phase, it is controlled by the central pattern generating circuitry of the brainstem and the peripheral reflexes. That is how the brainstem works during swallowing. So in the brainstem, it is within your medulla oblongata. The medullary reticular formation is responsible for screening out all extraneous sensory patterns and for responding only to those patterns that indicate the need to swallow. The reticular formation also assumes control of all motor neuron and related muscles needed to complete the swallow. Okay? Again, your pharyngeal swallow is controlled by your CPG circuitry of the brainstem. During the pharyngeal phase as well, the velum elevates and retracts, closing the velopharyngeal port to prevent regurgitation of material into the nasal cavity. So what is regurgitation? You know what
Balik ang food, miss.
Okay, the action of kanang marag siyang mugag ba. Okay? So, imbes mo naog ang food, musaka siya. Right? So, the tongue base elevates to direct the bolus into the pharynx, and then the hyoid and the larynx elevate and move anteriorly, beginning of the closure of the larynx at the vocal folds, the laryngeal entrance and epiglottis to prevent material from entering the airway. Okay? Why? Because what if the food enters our airway? What will happen?
Katong aspiration pneumonia, miss.
The aspiration pneumonia. Very good. Okay. Next. Where are we? Okay. In the pharyngeal phase, we could expect, okay, the pharyngeal tube elevates and contracts from the top to the bottom in the pharyngeal constrictures using a squeezing motion. Okay, so we call this squeezing motion to move the bolus through the pharynx towards the esophagus. Okay, that is how the bolus is transported to the esophagus. There is a squeezing motion of the pharyngeal constrictors. Here, the upper esophageal sphincter relaxes and opens, allowing the material to enter the esophagus. This movement must be rapid and efficient so that respiration is interrupted only briefly. The pharyngeal phase of the swallow takes approximately 1 second still to complete for thin liquids. Okay, so before entering the esophagus, we have a sphincter. Okay, so it controls food, the entry of food towards the esophagus. Questions so far? Questions before we proceed to the last phase, the last stage. So the last stage is our esophageal phase. Remember, from pharynx towards the esophagus, the upper esophageal sphincter opens, and then the food enters. Okay, so that is the beginning of the esophageal phase. The esophagus is a straight tube approximately 10 inches long that connects the pharynx to the stomach. The pharynx is separated by the UES, or the upper esophageal sphincter, and the LES, the lower esophageal sphincter that separates the esophagus from the stomach. Okay. Next, during the swallow, the strong muscles of esophagus contract again, and the bolus is transported through the esophagus by peristaltic wave contractions. The overall transit time of the bolus, no, from the oral cavity towards the stomach varies from 8 to 20 seconds. Okay? So, mula pas na ganing let's give an allowance of 10. So let's say 8 to 30. If our client reaches siguro 1 minute para lang iswallow ang food, then there's really a problem. If makita na ninyo sa assessment nga, dugay, jud kaayo niya maturon ang bolus, like let's say 5 minutes before ka maka-proceed na pod sa next na scoop na mo ihatag. Okay? Then there's really a great problem for the patient. So, after that, makita, dugay man kaayo niya maton. So, imong tan-awon and review the client factors. So, asa day dapit siya na problem? Is it in the muscle tone? Is it in the muscle strength? Sensory problem? Or it could be the cognitive problem. Okay. So, as the food enters the esophagus, the epiglottis returns to the relaxed position and then the airway opens. Because remember, from pharynx to larynx, di ba na-close man ang larynx. So, the airway is closed. So, moto ingon ganiha nga, dapat brief lang jud kaayo ang pharyngeal phase para mo-open balik ang atong larynx and then the respiratory process would continue. Okay. Questions? Questions regarding the 4 phases of swallowing and how does the bolus transported? None. Okay, so let's have a quick review by watching this video again. Can somebody share, please?
With a normal swallow, food and liquids move from the mouth into the esophagus directed by a precise sequence of coordinated muscle movements. In order to adequately describe the biomechanics and bolus movement during swallow, the 4-stage model was developed. Let's slow down the animation in order to more clearly appreciate what happens during normal swallow. The 4 stages are as follows: oral preparatory stage,
So
oral transit
chewing,
stage,
transit,
pharyngeal stage,
na-close ang larynx, and then
esophageal
esophagus
stage.
towards the
During the
stomach.
oral preparatory stage, food is kept in the front part of the mouth where it is moistened with saliva and chewed into a softer consistency. Once the food bolus has been processed by the mouth, the oral transit stage begins with the tongue raising up against the hard palate while the back of the tongue drops to allow the bolus to move into the back of the mouth. Simultaneously, the soft palate raises up against the back while closing off the passageway into the nose, preventing any food or liquids from regurgitating back up into the nose. The pharyngeal stage is a rapid sequential activity during which the bolus is propelled into the esophagus. The larynx elevates while the epiglottis flips down, protecting the airway. Not clearly shown are the pharyngeal muscles which contract, squeezing the bolus downward. The cricopharyngeus muscle, or upper esophageal sphincter, relaxes and opens to allow food and liquids to pass into the esophagus. Once the bolus passes the cricopharyngeus muscle, the esophageal stage begins. The cricopharyngeus muscle closes back up to prevent any regurgitation back up into the throat. The esophageal muscles continue to propel the bolus into the stomach by a coordinated muscle contraction and relaxation known as peristalsis. The mouth and throat resets to prepare for the next swallowing event. Should there be any deficits or coordination problems at any point during the 4 stages of normal swallow, choking, aspiration, nasal regurgitation, or even the complete inability to swallow may occur.
Nakita rag ayo ang process of the 4 stages. Imagine nyo sa ninyo. Alright. So, that's it for dysphagia medical literature. Any questions? Questions? Clarifications? None so far. So if there's no other questions, I can dismiss you early. And you can work with Miss Denise tomorrow or discuss for the assessment and intervention. Okay, you can also read in advance your pediatry for assessment and evaluation. Okay, clear? Because you still have about an hour also to read in advance OT apps. Okay, so thank you so much and see you next time. Okay,
Thank you, Miss.
Thank you, Miss.
thank you also.
Thank you,
Bye-bye.
Miss.